Health promotion is a huge component of what nurses do. We would rather teach people to be healthy and stay healthy than treat them when they're sick. In this video, we're going to tell you exactly how to promote patients' health. Go ahead and get out all your study tools, your concept guides, your highlighters, your pens, your notebook, and get ready to study along with me. We'll be in Giddens 42 and Davis chapter 42 as well. So you're going to need to complete that concept study guide on health promotion and be able to answer the following questions by the end of this video. So go ahead and pause this, take a screenshot, write these questions down in your notebook, and be prepared to answer these questions as you go through this training. So in order to discuss health promotion, what is health promotion? First, we have to discuss what is health. And so the World Health Organization describes it as a complete state of physical, mental, and social well-being, not just the absence of disease. So disease is here, okay is here, and wellness is on this side. And so we are aiming for wellness, not just the absence of disease when we're promoting health. And so health promotion is the process of enabling people to increase control over and improve their health. And we're going to be promoting health in terms of their health, their wellness, managing their diseases and illnesses. And all of that is what we do as part of health promotion. As nurses promote health, we promote health across the lifespan, from babies to the elderly to everyone in between, from the individual to the family to the community, and even for things like the environment and how that increases or does not improve our health. And there's different categories of health promotion. So primary prevention are activities that we encourage that are going to keep people healthy. So things like encouraging eating a healthy diet, physical exercise, wearing sunscreen so that you don't get a sunburn, or even wearing a seatbelt so you don't get injured in a car accident. Those are all health promoting activities, primary prevention. Secondary prevention are screenings where we're going to try to identify diseases and illnesses early so we can treat them quickly. Things like blood pressure tests and diabetes glucose checks. And even I've seen a kidney mobile come around and do local kidney screenings in areas that had high risk for a lot of renal failure. So they'll check different blood panels for renal screenings. So those are secondary prevention, screenings that are going to help identify illness and disease early so it can be treated. And then finally, tertiary prevention. Tertiary prevention is meaning a patient already has a disease, but we want to prevent that disease from getting any worse and to get them back to as best of a state of health as we can. So what are the attributes and criteria of health promotion? First is that the goal is optimization of health, focusing on that high level of wellness, preventing illness, and early detection and management of disease. The second is that evidence, research is what drives what health promoting activities we do. So when we know what diseases and illnesses and risks a specific patient or specific population or community are going to be at most at risk for, those are the things that we're going to be promoting in terms of health prevention. So what's the scope? Oh, nope, we did that one already. Go back. Patient and community centered. So we're going to be doing things at the patient, family, and community level to decide not only what the needs are for health within that community or individual, but also what their individual desires are. And motivation is really key for in order for health promoting strategies to really turn into lifestyle changes. And so we need to get a sense on how motivated a patient or a community is to make those changes for health promotion. And finally, enculturation. So remember, it's not by accident that we're talking about culture and health promotion in the same week. So being culturally competent and sensitive to different cultures is so important. And remembering that we're designing and implementing and evaluating health promoting activities that incorporate and respect the values and beliefs and interpersonal dynamics targeted to culture. Now, when it comes to the theoretical link section of your Giddens, don't get bogged down by the individual theories and theorists. I'm not going to test you on those as specific theories or theorists. However, I want you to notice that the models of health promotion can be broken down into both individual and community level. And so some health promoting activities and interventions are going to be for specific patients, and some are going to be for a whole community. So what's the national health agenda? What are we doing as a nation to promote health for our country? Well, it's something called Healthy People 2020, and it's in box 42.2 of your Giddens text. It's a national initiative, and it addresses the effect of lifestyle on health, because lifestyle absolutely has a huge determinant on our wellness. And then it's created health improvement goals for us as a nation, and it also seeks to eliminate health disparities that they've identified by specific either ethnic or cultural backgrounds. And the reality is we live in a society driven by the bottom line. And so for payers, the cost of providing health promotion services must outweigh the consequences. So it has to have a net positive value to the health promoting activities. So we need to know what health disparities exist among vulnerable populations. So vulnerable populations are more likely to develop health-related problems and experience worse outcomes from those problems. And specifically, we're talking about vulnerable populations being ones of low socioeconomic statuses and people who are members of ethnic and racial minorities. We're going to be diving into the idea of health disparity a lot more in class and then as you go through this program. But just recognizing that there are differences in health outcomes based on where you live, what your ethnic background is, and that shouldn't be. And that's one of the drivers of Healthy People 2020 is to not allow those types of things to determine your outcomes for health. So how do we assess for overall health? Remember, assessment, first step of the nursing process, we need to have assessment data. We need to know what we're working with before we can make decisions on what to do with it. So your assessment is going to be based on whether you're doing an individual assessment, a family, or a community assessment, and you're going to be assessing for risk factors and also for the values and preferences of that individual family or community. Take a second and pause this and read through the specifics on that in your text and on this slide. So what health promotion activities do we do as nurses? Now I put this on the screen behind me because this is key to what we do. We want to prevent infection, prevent disease, and promote wellness. And some things we do are immunizations, screenings, provide nutritional health guidance. That's why you took a nutrition course before you got into nursing school. Encourage physical activity, and even consider encouraging different programs for smoking cessation or weight loss. But the number one thing on this list is patient teaching or education. So we do so much of this as nurses. So if you'd ever thought you'd be a teacher, welcome to the teaching club, because nurses are teachers and we're teachers every single day, whether it's discharge instructions or teaching about a new disease state or teaching how a family can keep their child safe as they put them into a car seat appropriately. We teach. And health promotion, probably the best thing that we can do is teach our patients all the time, be assessing for their risk factors, and be providing teaching and education so that patients and their families are best equipped to promote their own health. So these are the interrelated concepts with health promotion. Many of them we're going to be discussing in 107 and 108. Things like evidence that supports what we promote in terms of health promotion. Things like self-management and adherence, how well patients can follow and manage their own health. Their developmental state and whether they're cognitively able to understand how to manage their health. What's their nutrition status? Because that certainly it makes a difference in our own health. And what's their mobility like? Someone who has a limited mobility is going to have limited access to exercise, and that's going to have a trickle effect on their health. So you see how these concepts all interrelate, and we're just at the beginning of your nursing education. So I know we haven't talked about a lot of these yet, but hopefully some of these concepts you can just draw from your own experiences and knowledge and understanding, and we'll continue to build into that as we go. Finally, your Giddens text has some excellent exemplars at the end of the chapter about things that we do to promote health, vaccinations, oral hygiene, nutrition, physical activity, blood pressure screenings, and breast cancer screenings. Please go ahead and do read through those so you have a better understanding of what those exemplars are. So remember, patient teaching is probably one of the best things we can do as nurses to promote health, assessing risk factors and providing teaching based on that. Thanks for listening. I'll see you in class.